is for all of us to have these blessings. So I do really enjoy the sharing of the testimonies. I just heard back from a church in the Santa Rosa, Petaluma area that I was at not so long ago, and they were just inviting me back to do another ministry event with them. Very nice church. It was wonderful. They drew on people from the whole region. So it wasn't just their church family. They had people coming from, neighboring towns and neighboring churches. It was a very special event, and I had a wonderful time with them. And so as they invited me back, I'm actually going to be there in March. I'll be there next month. So I found a time that I could get out there. And the feedback they gave me was, I guess I was doing, it was a healing event, but the people took my explanation that I like to always give you before I pray into the body, because otherwise nobody knows what I'm talking about. There's no way you'd understand these things medically if I don't give a little explanation. And then you can relate to it more personally anyway. And they gave me some very nice feedback because what they said was you're teaching, and I wasn't really teaching. It wasn't like a class tonight. It was a healing event. But they took it that way. They said a lot of the people took that and they're starting to pray with it and getting great results. And they said that was the feedback they got at the church. The people were really happy because they had never ever been exposed to this kind of prayer. They'd never seen anything like it or heard anything like it. And now that as many as can, they're taking it up. So what they wanted to know was, they said, people are asking us, would you bring, next time you come up, which will be in March, they said, can you bring slides? They said, would you be willing to bring like some brain slides, for example, so that we can understand. They said even if you did a printed out sheet that showed the parts of the brain, or if you wouldn't mind if we replicated, what you have. So I'm happy to do that. It's again what I've been doing here. So I said I'll bring, with the testimonies, because it's a healing event, I will bring some brain slides, and then they can replicate those slides and give them to the people to work with, because they're very hungry in that area to bring that into their prayer life, praying for others, being on prayer teams at different churches, and bringing that to people. They're recognizing that this is really the Word of God, the creation of God, and they want to be able to pray into it. This just came in the last day or so, where they were asking me, they were confirming a date, and then they were asking me about the slides. And I really do love this, because more and more the feedback I get is of people not only being healed themselves, but really wanting to use this for the healing of others. And that's very biblical. I mean, there's nothing, it's very biblical. God wants us to love one another, He wants us to heal one another, and He wants us to have knowledge. So what I like about Pastor Tony here is that he's very devoted to me coming back. He has me here. When we were on the phone, he said, look, let's just do the rest of the year. And he has me coming the first and second Wednesdays and the third Wednesdays. I'm down in San Jose with another church. And I forget what I do the fourth Wednesday. But anyway, I have another thing on the fourth Wednesday. But anyway, I really like this, because it's not like I'm going to be teaching one time, and if we don't cram it all in, and I try to teach you all 20 years of medical training in like 1 hour or something. We have time to digest it. You can ask me questions that relate to your own personal life, your own personal experience, feedback. I think that's very valuable, because then you get to have more of a personal relationship with the material. So please feel free to do that tonight. Any questions? We're not in a race here. The main things, I want you to get enough so that, first of all, for yourself, it's going to be a blessing. That's the number one, is you got to have it be a blessing for you. You don't want to be the shoemaker with no shoes. That's not a fun place to be. Everybody you know is healthy except you. You pray for everybody and they're healthy, but you're not healthy. So we started working with the endocrine system. Last time I was here again, Pastor Tony, as you remember, wanted me to, that's when everybody was standing and we were doing a lot of personal prayer. And again, I'm happy to do whatever you want. You just tell me, I can start talking and giving the information, and then if you want me to deviate into prayer, which of course we want to do anyway. So whatever you all want, I'm here to fulfill. And this is this is an unusually small group. Usually we got a lot more people here than tonight. This is unusual. And I never know what the church is. A couple of the churches I've been in, they've had more people than normal. Like I was looking and, they might have 2 or 3 times the normal amount. So they were pretty stuffed. And then every once in a while you'll have so anyway, this is a little unusual here because usually we got a lot more of my friends from the church here. But it's just how it is, sometimes there's more, sometimes there's a little less. But the good news about that is because we're a little bit less, yes.
How do you pronounce that?
Which thing?
That system.
Endocrine?
Endocrine.
Yeah, it's endocrine.
Endocrine, okay.
So the good thing about when there's a little less people is it just gives more time to personalize things for you all. So, we can almost look at it that way tonight. It's almost more of a, personal tutoring class and healing event. So feel free to use it that way. So the endocrine glands, we've gone over, as I remember, the thyroid and the thymus. And this was the next level I wanted to work with. I would have done it last time I came, but we did pretty much the night of prayer. This is very important material for everybody to know, for your blessing and your strength and your health. If we don't have this, we just don't have anything. There's certain foundational things that you've got to have. I just did an event with a woman, this is an event I did in Sunnyvale, with a woman who I haven't seen for a while, but she's come to a number of our events. But it's been quite a while. She had come like a year and a half ago when we were just starting. And then she didn't come to get any more healing or anything. And during that year that she wasn't getting any prayer, her health degenerated. She finally came back because she's desperate. And she said she's in so much exhaustion and fatigue. Her systems are so worn down that she says she can barely work anymore. She's, I unfortunately see that more than I'd like, where she's a lot of time in bed and she's not very productive when she's working, which is an even bigger problem because there's just nothing, the more energy you have, the less, you can get along on less sleep if you need to, and you got a lot of get up and go when you're doing things. So this woman just collapsed basically. And one of the things I had to work with her was the endocrine system because it was just absolutely worn out with her. So she was much better. She was much better when she left the event. But we're kind of looking at parts of the endocrines today that are really bottom line crucial and important for you all. The things you all know about and have heard about, but we're going to go into more detail and pray for you all and work with it. So again, just a little bit of review that the endocrine glands, like the brain, are the parts of your body that, again, if they're not there and they're not working, you're not going to be healthy, period. It's like the brain, this is the other part of you that is that crucial for your health. And it's so important that God entrusted the function of the endocrine glands to 1, 2, 3, 4, 5, 6, 7, what is it, 8? 1, 2, 3, 4, 5, 6, 7, 8, 9, if you look at the male and female. So there's a lot of endocrine, and they all have their own particular functions. The hypothalamus, pituitary, pineal, of course, as you remember, is in the brain. So those are the master glands regulating everything. I might do a little review on that. And then going from the top down, you have your thyroid. I didn't put in parathyroids there because they're not all that big a deal for your purposes. Thymus, we're just going throat, chest, abdomen, kidneys, ovaries, testis. We're just going top to bottom. And each and every one of them you can't be without it. It's not like, oh, one of these things isn't important, it's not as important as something else. They're all crucial for your health and wellness. Every one of these, of course, makes the chemicals called hormones, which are chemical messengers, and we make it in the brain, and then the brain sends its own hormones out to all these other glands in the body, and then they make their own hormones, and they go out to every cell in the body and give messages. And if those messages aren't delivered properly or the messages are incorrect, it's one of those things that triggers illness of every part of your body. It's not like you can get along without those messages. You've got to have them.
So when you hear the term hormonal imbalance,
you're genuinely in hormonal imbalance. Part of the imbalance comes from the fact that the brain neuroendocrine system, with the hypothalamus, the pituitary, and the pineal, their hormone levels on blood testing are abnormal when the lower down hormones are abnormal, because it's a feedback system. It's a feedback loop. When the endocrine systems of the body, the endocrine glands, aren't making enough hormones, then they go into overdrive in your brain and they spike up the amount of hormones that they're producing to try to force you to make more hormones in the more peripheral glands. And so that you might be low in the peripheral, high in the brain, and sometimes the brain hormones, even when the body hormones are low, the brain hormones are low too, because they're sick, really sick. So that's not a good situation. Let's go to the next one.
on the way, I
Yeah,
want to
please
just say
just
this,
ask me anything you
because
guys want.
I'm kind of an audio-visual person too, so when I started, I started looking at the system, just kind of, and that's why when I first saw you today, I was like, these bodies are amazing, and thinking about the endocrine system and all of the intricate parts thereof, but because when I was reading, I was like, I need to see, and sometimes just taking a look where these parts are. Yeah, exactly. I mean,
No, it's good to
really
do
helpful.
the visual, and I do put those in there. I can't remember if I have them in today, but that looks like one of those kinds of pictures. If it's not the picture I put in, it's similar to what I've put into some of these programs. So let's go to you all remember, because we've spent a lot of time talking about neurons and neurotransmitters, correct?
Mm-hmm.
Everybody remembers those.
Mm-hmm.
And here's again some of these crucial connections created by God, not created by you or me or some doctor in their medical office. But when I said the three levels, the brain, the more peripheral endocrine glands, and then going out to the cells, it's an integrative, interactive process. It's not like you have a brain here doing some production of hormones from the hypothalamus and pituitary, and it's like you got to get those levels right, and then you've got down here the thyroid or the thymus, and they're doing their own thing. No, these chemicals put out by the endocrine system in the brain specifically are put out to trigger all the other glands downstream. So everything is interactive, and they're also interactive with the brain. So that's what first happens. Like if your brain is wiped out, like the fellow that I mentioned with the wife who had all the tears in her skin, and he had a stroke, and he just looked like there was nobody home. Brain fogging when I first saw him, and kind of spacing out, and speech was somewhat impaired with him. When I first saw him, he was not in very good shape, wasn't smiling, just didn't feel well. Stroke wasn't healing well with him. So if your brain is not functioning well, it triggers the endocrine system. So everything depends on everything else.
Mm-hmm.
And so when you pray for people, let's say you're gonna pray for somebody's, like we're gonna talk about the pancreas. So let's say you're praying for the pancreas, or you're praying for the thyroid or whatever. You have to remember when you're praying for it that it's a stepwise progression. If you can remember just the crucial parts, you're going to get really far with this. And I try to do that. I try to filter it down so that when you have this information I'm giving you, I could give you, unlimited amounts of information. But let's focus on the information that's going to really make the difference if I had to pick one thing. So if I had to pick two things in the brain, I would pick your neurons and I would pick your neurotransmitters. And the reason I say that is the neurotransmitters are in the neurons. So, and the neurons are easy because there's almost 100 billion of them, as you guys remember. And they're the foundational cells anyway of the whole brain and the nervous system. And within the neurons, because that's the main software program of your whole body. And within the neurons are your neurotransmitters, the inhibitory and the excitatory. And what we know from the medical field is that inhibitory neurotransmitters like serotonin and excitatory neurotransmitters like dopamine together trigger the whole endocrine system of the whole body. So just think about that. It's dependent, the whole endocrine system is dependent on a couple of neurotransmitters in your brain. And if they don't work, you don't work. It's a pretty big deal. That's why this brain is all important. I just can't say enough because it regulates everything. So if you just think things like serotonin and dopamine and some of the other ones that I mentioned are needed for the whole endocrine system to work. If you just remember that and you pray into that, that simplifies this to a very big degree.
Okay, Dr. Richards?
Yes.
So would you give us a little sample prayer of praying for the pancreas? You said if you do these 1, 2, 3 steps.
Right.
So,
Do you want me to talk about the steps first and then pray, or do you want me to?
Yes.
Maybe it's better if I just go over the steps first.
Just steps first.
But in doing this, I'm really trying to pinpoint this, that, and this is true with not just humans, it's true with animals too. I just keep praying for more and more animals, and I'm amazed at seeing the same diseases that humans have, the animals have, and the vets don't do much better for the animals than our doctors do for us.
Wow.
In fact, in some ways they do worse because they get worse diets. At least we can go out into Whole Food Market or Sprouts and make some smoothies. Those poor little animals, they're given canned dog foods and stuff like that. And, it's a special family that gives their animal pets, homemade dog food and vitamins. And most people, they don't know how to do it. They don't have the time. So I just prayed over the weekend. This was quite an interesting weekend because for and I may bring their pictures next week. I'll give you more information. 2 collies who were they're old collies, and they're really, you know how a collie looks, big, fat, beautiful collie with all this hair and gorgeous looking. Well, these were kind of mangy looking little collies. They were thin and, poor digestion, and they just didn't look real super healthy, and they have a lot of health issues. I'll bring their pictures. They're precious dogs. I really liked them a lot. They're sweet, they're nice, but they didn't look healthy. And then the owner, very nice woman, she's having a lot of her own, health issues and things. So, but it was a real pleasure to pray into the collie's brain and endocrine and nervous system, because they had miracle healings that weekend. Both of the collies had a series of miracles, for which they just weren't getting any better. They were at the vets, and so I was really happy. She brought the collies to both places. I didn't even know if the collies were supposed to be in the church I was in. The second, I said, I don't even know if they're supposed to be here. But anyway, she brought them in and sat in the back with them, And they just love the prayers. It's amazing how they know they're getting prayed for, and they respond. They get these beautiful healings. And then remember the cute little dog, the 114-year-old that I've shown a couple times with the chronic pancreatitis, who was, you all remember him, right?
Yeah.
You do or you don't, or?
Yeah, I think so.
He's the cutest little dog, and every time he sees me, he never acts this way with anybody else, his owner told me, but he jumps on me and he wants my hand on him, because I hand healed him. I did laying of the hands on the dog, and he whines and squeaks and waddles in those circles till I get the hand on him, and then he's really happy, because whenever he needs healing, he wants the hands on him. So he's the cutest little dog. He's the cutest little thing. So anyway, here we are back. So the neurotransmitters, all I'm trying to say is they're really important for this. And what they do is, I was giving you before the information about if you're inhibitory dominant, or you're excitatory dominant, or you don't have enough of these. Remember, I've shared with you all the different diseases that fall out from this. The other thing that they do, and all the cells of our body do this, this is more in the area of what we call the mechanical, the biophysical, the electrical part of how our bodies work. So all these chemicals pulsate. In other words, they're not just flat chemicals. When you have no movement, you basically have passed on. The definition of life is movement. If you can move, you're alive. When a person's passed on, nothing moves, nothing's happening in the body. The EEG is flatlined, so that these pulsate. And when they're not pulsating properly, they can't make the whole endocrine system work. This is very medical. This is something that is right in the medical field. And we know that when kids are blind, or they have certain kinds of electrical chemical imbalances, even when they're 13 years old and the kids are supposed to go into puberty and their endocrine system is supposed to activate, and that's when boys grow bigger and their feet grow longer and their voices get deeper, and girls start menstruation and all that. If they're not pulsating properly, these things don't happen, and they get delayed, and that becomes a medical issue. So the pulsation and the chemicals themselves are really important. So just remember, I'm just trying to give you a few crucial things to pray for. You want to get this to work, pray for the chemicals like serotonin and dopamine to be in the right ratio and to pulsate the right way. All you have to remember is that. You don't have to remember all the details that people in my field have to know. And then that's going to trigger hypothalamus, pituitary, and pineal. And then look, see all your organs and cells and glands and the function of the endocrine, it's not going to work. So let's go to the next one.
Okay.
And and then just a little review of the hormones. We just talked about that, which is that once the glands are activated by your neurotransmitters, let's go back to the hypothalamus, pituitary, and pineal, then they put out their own hormones, their own chemical messengers. In the hypothalamus, they're called releasing hormones, and the pituitary, they're called stimulating hormones. And all these hormones have very specific functions to get the glands that are the next level down from them working. God is so efficient, he's so orderly, it's amazing. Let's go to the next. And then again, what we talked about earlier was 3 levels of hormones in this whole system. Hypothalamus and pituitary, when they're activated by neurotransmitters, they create releasing and stimulating hormones, and that controls the hormone production of all the glands in the whole body. Once they're stimulated by the hormones from hypothalamus and pituitary, they produce their own hormones, and those get released directly into the blood. They're carried to cells, organs, tissues all over the body. That's how crucial this is. So let's go to the next.
I have a question.
Yes.
What causes fibroids in women, and particularly like in their...
Well, okay, so see the 3 levels here? Okay, what happens with fibroid tumors, we're gonna start at the lower level, but you have the hypothalamus and pituitary stimulating hormone production for both male and female reproductive glands. Ovaries in women, testis in men, and then the adrenals in both male and female, because they all make male-female hormones. So that's the ultimate regulator. Then they put out chemicals called FSH and LH. Men put it out and women put it out. It regulates the whole reproductive system. And then those chemicals, those hormones that are made, let's look at the female, that's estrogen and progesterone and a little tiny bit of the male hormone, testosterone. That's what women make. Then those go out to your target organs all over the body. You know, and the uterus is one of them. But it's everything. It goes to your heart, it goes to your brain, it goes to your lungs, it goes to your liver, it goes to your skin, it goes to your hair. Like literally your memory, your heart, your bones, your joints, everything's regulated through estrogen, progesterone, testosterone. So and we never talk about this in the medical field. You come, if you're a woman, we're looking at fibroids. Guys, we look at things like prostate cancer or BPH, but they're very related to the endocrine system. These things affect every part of your body. And so what happens with fibroid tumors is you have an imbalance in the estrogen and progesterone. To make a fibroid tumor, you have to have too much estrogen and not enough progesterone. Why is this? Because estrogen is a growth-stimulating hormone. So wherever it grows, it stimulates growth, which is not a bad thing. If you have estrogen in the bones, it means you have thicker, denser, stronger bones. The male hormone, testosterone, does the same thing. It causes thick, dense, strong bones in men and a little bit in women because we have a little bit of testosterone functioning. It makes your skin thicker. Again, what I'm talking about is men and women both. And then, let's see, your cartilage. Like, you know, when you hear about bone-on-bone arthritis, you know, where people say, oh, I've got bone-on-bone arthritis, I'm in so much pain, I can barely walk, I can barely function. All that bone-on-bone arthritis means is that you've worn down the cartilage, and you wear down the heads of the bones in doing this, and there's no cushioning. And these chemicals that are your male-female hormones literally create things like, like cartilage, like collagen, that cushion. They build up strong bones and they cushion the bones at the end. And where you have joint capsules, like we have a joint capsule in the hip, we have a joint capsule in the shoulder. And what happens is the head of the bone inserts into the joint capsule. That's when people end up getting, replacement therapy for knees and hip replacement therapy, is because this head of the bone that is jammed into the capsule is not aligned properly, it's stuffed in too far. And what happens is you wear down the cartilage. You wear down the cartilage of the bone, you wear down the lining of the joint capsule itself. So if I could, I'm going to put this down for a second. So, or here, let's pretend this is your bone. Let's make this a bone. So let's call this the femur. That's the biggest bone in your whole body is your femur right here. So here's your femur, here's the head of the femur. And if you're in the acetabulum, which is the joint capsule of the femur, and it's not the way it should be, this thing is jammed in. And while you're walking, you could be, exercising, you could be jogging, you could be playing golf, you could be walking around. Anyway, this thing jams in here like this, and this wears down, it thins out the cushioning, which is the joint capsule. Below the joint capsule itself is bone. All you're dealing with below muscles and cartilage and is bone underneath these cushiony surfaces. So unfortunately, that's what happens is you get this wearing away, and all of a sudden you find out that you have a hard time walking, you can't rotate or extend or flex your hip joint, and what does your doctor want to do? They immediately want to go do surgery. Now it's interesting because there are more less invasive ways to work with it. Number one, of course, is prayer. And if I'm gonna pray for something like this, or a fibroid tumor, which I'll mention a little more of in a second, I'm gonna work through God to ask him for the correction of what should be there. For example, if you have chronic pain and you've got a lot of disability and you've got pain in the joints, pain in the bones, pain in the muscles, again, it's not normal to have this thing be jammed in and wearing down the tissue, and you also wear down the muscle, you wear down the joints, you get bone on bone, so the head of the femur might be worn down. So what the surgeon's gonna do is they're gonna, of course, put in an artificial joint capsule and an artificial head of the bone. So they may shave the bone down, put on an artificial head, and that's okay if it works. The problem is about 30% of the surgeries done every year are redos. What does that mean? It means it didn't work. And some people get surgery after surgery after surgery. And the problem is every time you do a surgery, you're cutting through all these tissues. You end up with scarring or adhesions. You've cut through muscles. They're never going to be the same. You're ending up with scarring, and the next time you have to go in, you're cutting through scar tissue, and that's going to create more scar tissue. And if you're shaving down the head of the bone, sometimes these things don't work because the materials they use don't fit for the person. Let's say there are 3 or 4 different materials they could use for the replacement therapy, and they happen to pick one that your body rejects. It isn't compatible with your body's ability to deal with that kind of synthetic, and so that can be a reason that you end up with literally your whole femur coming out of the joint capsule. It just won't stay put. I don't know if you all have ever seen that. It's pretty rough. I've seen that with patients where they have to have a redo on their surgery because they can't keep the bone inside, the joint the way it's supposed to be. Or they misalign it. Let's say the surgeon didn't line it up really well. So again, you're not going to be able to walk well or get out of chronic pain because things are not aligned properly. Now that's one thing that a few of the chiropractors who know how to work with extremity manipulations can work with. Not every chiropractor can do this. Most of them are trained just to crunch the spine and the neck. But if they do know extremity manipulation, they can literally pop the femur out of the joint capsule. Oh, that's, again, when we've talked about that with you all. That's a wonderful thing because it just pops it out and it's in the right place all of a sudden, and the pain, you can feel the compaction release and you hear a big pop, but it's a very good pop because the bones moved out of the capsule. That's going to save a lot of wear and tear. It's worth getting some periodic chiropractic adjustments just to save surgery. The other thing I'll do to complement, let's say that person is seeing a chiropractor or they're not, I can spiritually, through the Lord, move the bones and the joint capsule away from each other. It's amazing. God honors these kinds of things because it's not like God can't do it. He can do everything. So I will pray that we move the femur out of the joint capsule and get it down and not so jammed up. And then I'll ask him to expand. I'll ask him to grow new cartilage, more cushioning, relaxation of the muscle, so we don't have so much pain. And or people say, oh, I got so much pain in my hamstrings or my quadriceps are killing me. And so I like to pray into these things. And then it releases pain, it releases diminished function. So again, these things are partially hormonally based because all the thickening of these is relegated to the hormones because the testosterone and estrogen are growth stimulating hormones, whereas progesterone is a growth limiting hormone, so you don't get into the point where your tumor, let's say you have a fibroid. Now that gets into your question about the fibroids. So they're estrogen stimulated, and they grow in 3 places. They grow on the outside of the woman's uterus, within the wall of the uterus, and then inside. And in every case, they can cause anemia, abnormal heavy bleeding, and what happens to the woman? You're at the doctor getting a hysterectomy. No different than a hip replacement surgery. Something doesn't work, you go get the thing, cut. And then you end up with all the scar tissue and all the restrictive motion if it hasn't been aligned properly. I can go on and on about this. So I prefer conservative to surgery if we can at all do that. And so with the fibroid tumors, some women grow gigantic tumors. They can be like watermelons, and they literally, a woman will look like she's 9 months pregnant, and she's really embarrassing because everybody congratulates her on her pregnancy, and it's just a big fat huge fibroid. There's no pregnancy there at all. I remember Dr. Malou had one of those patients that she walked around, thought, well, hey, when's the baby due? And this woman actually had never been pregnant. She wanted to get pregnant, but she's never going to get pregnant with this huge watermelon-sized tumor. So it disappeared, and I do believe she got pregnant after that. I've seen the same thing with my own prayers, where I've had women call me, they're at their doctors, and they've been told they're never going to get, if they're infertility cases. And, then God heals them, takes away the tumor, and we have a happy family. So that's yes.
So, I remember years ago, my sister-in-law had fibroid tumors, a bunch of them, like this big, and I ended up seeing pictures, but
Of the fibroids?
Yeah.
They can get really big.
They were pretty big, like cantaloupes or something. But again, what causes that? I mean, is it diet? Is it not? What stimulates them? Yeah.
Well, it's two levels, and this is where integrative medicine is really important, because the first thing that stimulates it's just the chemical imbalance in the body, and that's your estrogen progesterone imbalance with females. So too much estrogen is growth stimulating, not enough progesterone. You don't have the growth limitation that the chemical progesterone does. So first of all, you want to get the chemicals balanced again.
Right.
Diet plays a huge role, because a lot of things stimulate estrogen in the body, and this includes guys too. Guys can have too much estrogen, and it's feminizing to the male body. It's not a healthy thing at all.
Right.
It's not like what happens to a female, but for what the man's small level should be, it's too high. Mostly we see that in guys who are alcoholics, because it's toxic to the heart, the brain, and the liver. So it means their own liver can't break down the little bit of estrogen that they make, and all of a sudden they get estrogenic changes like chest enlargement, the breast, where it's not like you've just worked out in the gym and you've got big pectoralis muscles. It's got a different texture and shape because it's hormonal. It's not exertional, if you see what I mean. So with women and men, if you want to have healthy hormones, this is even true for the male hormones, you really have to be careful. You've got to be careful with your alcohol intake, because it affects the breakdown of the male hormones as well as the female at the liver. And you want to be careful with caffeine, which can, if you have it in excess, can stimulate tumor growth. You have to be aware of that. That's something I remember reading in the surgeon's journal, the surgical journals. Not even for like the regular medical doctors. These were from surgeon to surgeon. They're very interesting studies on how caffeine can affect the body's growth, which can include tumors. And then sugar, sugar absolutely stimulates tumor growth. I don't care who you are. This has been known for decades. This has been known since the 30s, with foundational information coming out of world famous physiologists back from the 1930s who really started to understand the basics of how the body was put together, and so that's very important. Sugar is acidic, and sugar is tumor stimulating, and it stimulates infectious disease.
Question.
Mm-hmm.
Coffee,
Mm-hmm.
black coffee,
Mm-hmm.
even though it has some caffeine,
Mm-hmm.
I heard that black coffee
Mm-hmm.
is supposed to have some health benefits.
It does.
Okay, okay,
It's all amount.
right.
See,
I get you.
what we've seen in the medical field is if you have 1 or 2 cups of coffee a day,
Right.
you're not gonna have much problem. You don't take the caffeine or the other chemicals in the coffee
Mhm.
over the limit. And most people, unless you are severely sensitive / allergic and you just cannot handle anything, most of us handle a cup or 2 a day, even a nice sized cup.
Mhm.
But when you get to the level of some of the patients I've worked with who, 8, 10, 12, 15,
Oh, wow. Yeah.
20 cups of coffee a day, first of all, you get really sick from headaches and, all kinds of side effects, because it's really an excess.
Mhm.
And so it's a dose-related thing. If you're using lower dose, what does everybody use it for? For energy and strength and vitality, because caffeine stimulation does feel good. It kind of clears the brain, and if it's too much, you get a diuretic effect, and you lose minerals. Because when you produce excessive amount of urine flow, you lose minerals with it. Those are going to be the minerals, like, the basic minerals like potassium, magnesium, calcium that we need for energy, we need for muscle balance, we need for healthy heart. There's a lot of things we needed to produce energy at the cellular level. So again, everything is watching the amount. Fats is a risk factor as well, like too much saturated fat for benign tumors and cancerous tumors. Even, it's interesting, apart from diet, even walking reduces the risk of cancer. If it's breast or prostate cancer, prostate men, breast cancer women, flaxseed is really fun because it reduces the incidence or the risk of cancer by almost 50%, which is unheard of. We're lucky, you walk, you get 10%, you cut down alcohol, you get 10%. Flaxseed gives you almost 50%, it's like 48% or something.
Okay.
It's well worth using.
Wow.
If you want the one perfect food,
Wow.
even if you don't think it tastes that great, flax. Ground up flax. So the whole flax seed is just a laxative. If you're constipated, it can be helpful. But you get no nutritional value. If you don't break down the capsule of the seed, you never get the omega-3s released, the minerals released, the fiber. So just know you're not going to break down those hard little seeds. You've got to have them pre-ground.
So what about flaxseed oil pills?
Flaxseed oil?
Yeah,
I don't recommend them. I recommend just getting flax oil, like refrigerated, even a small container, like 8 ounces or whatever that you can get in the health food store. The reason being that well, first of all, again, if the seed is not broken down, you're not going to get any oil anyway. But the oil needs to be refrigerated, or else it goes rancid. And the flax oil is called alpha-linolenic acid. That's the medical chemical name for it. And it is really phenomenal. It's so helpful for your body. You can get it taking the ground flax meal, or you can just take it as an oil and use it on popcorn or baked potatoes or things you might put butter on.
wow.
I find with people that about 85% of people really like the flavor and about 15% don't. So if you fall in the 85%, you'll probably think it tastes pretty good. And you can use it for smoothies, shakes, popcorn, baked potatoes. I think I'm one of those 85%. I actually think it tastes really good. If you're in the other 15%, then we got to do other stuff with you. But these are all great questions. Just feel free to ask me any of this stuff. So anyway, what happens if you don't eat the bad foods and you eat a diet that promotes progesterone, which means beta-carotene, lutein, because they all stimulate progesterone production in the body. The big, huge old watermelon, all these things just shrink, shrink, shrink. It's like having a cancer that just shrivels up and shrinks. So all these benign tumors can shrink as well. And it's really a blessing to have that happen because no surgery, no mutilation of your body. So it's a really good, positive thing to have happen. So I'd much rather have that than have somebody cut into me. Anybody else have a question?
I have a question.
Yeah.
Diet sodas versus regular sodas, I have heard that diet sodas are worse than regular sodas, is that true?
Well, the sweetener is really bad. Like if you're having aspartame, for example, a lot of side effects. You get anxiety, you can get poor sleep, you can get hyperactivity, tremulousness, shaking. Unfortunately, aspartame isn't a very good chemical from the standpoint of its effects on the body, so I don't really recommend it. There's a lot of sugar substitutes now. You have to be aware that you don't have to just live off of white table sugar and sorbitol, which is used as an artificial sweetener. That's not very good. And this like aspartame or any of these artificials. There's a lot of sugar substitutes out there that are natural source, like coconut palm sugar, and they're not so unhealthy, and they do taste really good. They're quite delicious. When I put together those series of books that I did that I thought would be fun to do that were actually nutritional guides and they're beautiful cookbooks, we were working with all the substitutes. They're delicious. I mean, they really make great looking cakes, delicious tasting cakes, and they're probably better than the regulars. Anybody else or?
How about brown sugars? Do they have any health value?
Not a whole lot. Tastes good. You can make some good cookies with it. But I'd probably rather have xylitol, which comes from birch trees, or the coconut palm sugar, that kind of thing.
What's the other one? Stevia?
Stevia is good. It's a powder generally, but it's a flavor. There's no calories to stevia. If you need the sugar for texture of the food, stevia might not be the best choice because it's not going to give you much texture. There's no calories. You're just putting a little tiny bit in, but it can be very good for some recipes. It's just sort of knowing what you want to make and what the qualities are of the different substitutes.
So what about butter?
Oh, butter is such a sad thing. It's sad. I mean, who doesn't like the taste of butter? I have to admit, I think butter is delicious. If I didn't worry about my health, I would sit there with a whole package of English muffins that I would toast, and I would put butter all over them and just gobble them down. Just gobble and gobble. But unfortunately, it's not that good for you to do that.
Yeah.
So, like everything else, a little butter is okay.
Right.
But I'd be, same thing with yogurt, same thing with ice cream. One of my friends who's also a doctor just gave me a recipe for an ice cream made with like coconut cream and then navel oranges. Oh my goodness, they just blend all this stuff and it just looks absolutely delicious. I mean, it's amazing what you can throw together with these things. Anybody else? So let's see what we have next. These are good though. See, I think these questions are really good because they're in people's minds and they want to know what should they do. Okay, so hypothalamus, let's see, we talked about that. So the next slide, female, oh wait a minute, that's not what you guys are supposed to have. You're supposed to have, David sent you the wrong slides, I can't believe it. Okay, we're gonna speak to the right slides. You're supposed to have tonight the adrenals and the pancreas, as I mentioned earlier. So I have to ask him how this happened. David, we got the wrong parts of the body tonight.
But
So-
that, can I say, it is 9, so,
How much more do you want me to go? You tell me.
well, I think this is a good time to
Pray?
maybe yield tonight, yeah.
Okay, I'll be here next week. As I
Yeah.
said, I'm not in a race with you all.
Okay.
You know, I think it's really valuable because I cover a lot of,
Yeah.
whether I'm doing the testimonies of the pictures,
Mhm.
or whether I'm answering your questions, or whether I'm doing review or starting on the new stuff. It's all really important medical material. And it's all leading from one thing to another. So it's not a big deal. We'll just get into those next week. I'd rather that you all get questions answered and then I'm able to sequentially move through this than I'm trying to do some kind of a race where we're real rigid about what gets covered. That's what I like about you, Pastor Tony, is like last week, you just felt we should just do prayer,
Mhm.
which we did. But I really like your flexibility because you really like having people being able to ask questions and get their questions answered. And a lot of time that gets into these issues that we might not even cover in a class. So I think it's very valuable.
Well, I wanna say personally,
Yeah.
The consensus that you gave to be with us, even being willing to fill out the calendar for 2018, that is super valuable, okay, for what you bring, for who you are, for what you bring, and, and what you're offering to us, okay? I really wanna say
Oh, thank
how
you.
much we appreciate you being willing to do that.
Oh, that's very kind of you.
Yeah.
As you all know, I'm very relational,
Mhm.
so I love it. A lot of churches, like your church, keep having us back.
Mhm.
And I really like that because I like building relationship. That's really important to me.
Yeah.
Like this church that's just having us back in Santa Rosa and Petaluma, where they're already interacting with us. I'm not even teaching up there, but they're already, wanting me to, like, as I heal, do more and more teaching.
Mhm.
Because again, they're finding they want to pray into other people and heal, see them be healed. I think the relational part's really important. So that's something I really enjoy.
Yes,
And so, I mean, life is built on that.
sure.
And also, I think there's a real blessing when you come back because people tend to get more and more healed.
Mhm.
I see that at the different churches where I do this, is that it is progressive in that even if God gives us a big miracle
Mhm.
or a really significant change over a session, He still keeps working on us. Just, you could have a huge miracle, but there's still bits and pieces, both of you,
Yeah.
from the chats I've had with you all, I don't know so much with you all, but maybe it's the same thing. But there's been a lot of progressive healing because you keep getting exposed and blessed upon by God with this medical healing that just isn't available quite yet in other places. And it's very important. Like I can look at people, like just looking at you all tonight, I was dramatically touched by what I'm seeing physiologically, chemically, functionally improving in you all. It's pretty dramatic as a doctor, what I'm seeing with you all.
Oh,
Yes.
yeah, again, you see, I don't have my glasses on now, right? It is such an interesting thing that, as I drop the weight, take the sugar out, my vision continues to switch.
I remember it did,
Yeah,
yeah.
because it did it once before, and then I messed up.
Yeah, I
and
prayed
it
for
started
you, and I
eating
remember when I was praying for you, your vision was clearing up as we were praying.
Even as we were driving in the
Literally,
car,
as you were driving, you said my vision cleared up as I was praying
I
for
was
you.
reading, and, and I was wearing my glasses and didn't need them, so, because, and again, because, I was quote unquote nearsighted, so I needed my glasses. I mean, I couldn't see, there are 3 levels of hormones in the endocrine system from here, watching that television, you know, any of that. But, and I could almost read that Matthew 28 at the bottom of that sign over there, you know. There you go.
Well, that's
So,
impressive.
yeah, there you go. And so,
That's really tiny.
yeah, so it's amazing, how it, you know, division is continually correcting itself, and so, or certainly switching, so I do need, and really, I don't totally need glasses to read unless I'm reading, but I have gotten some readers just to help, they do help a little bit, but it's really phenomenal what's been going on even with my vision. You know?
See, I think
So,
people settle for too little.
yeah.
I really do mean that. I think people are used to, because that's how we work with people in the medical field. You know, if we can get you a little bit better, and like, you know, we'll say, well, my pain isn't as bad and it's stabilizing, I still have some. You know, we'll say, good, we're glad you're doing better. We might not even change your drug regimen, we might change it a little. But if you're going through spiritual and medical healing where it's really all coming under the Lord, there is no, God doesn't say I can only take your vision this far,
Right.
but he can take it all the way here.
Amen.
And I think that's the important thing about what the Lord can do with us if we stay faithful and we continue to work with these things. He doesn't stop. The only people that stop are ourselves. It's not that God stops on us. You know, we can turn our back, we can say I don't believe in God. People get very messed up from the enemy, feeding lies, feeding garbage into their mind. And if we can just call it for what it is and know that the enemy it will do anything to control us, to crush us, to bend us to the enemy's will, and try to reign. What did the enemy do with Jesus? You know, try to make the Jesus bow. Here's the Son of God who is God, and the enemy's trying to tell Jesus that he's God. Basically, you should bow to me. You know, I'll give you the world. And so, you know, the enemy has no shame. And the enemy will do that forever. If you let the enemy do it, he will crush your life. So we've got to be very cognizant of this and know that healing is part restoration and relationship and building in the Lord. But it's also absolutely getting the enemy kicked out of our lives, getting the enemy away from meddling with us, lying to us, setting up patterns in our life that are not the optimal patterns of the Lord. And people are willing to accept this because they somehow think that's what it's all about. That's what they're meant to have. That's what their families had. That's what they have. That's what they think, you know, if it was good enough for my parents, this misery is good enough for me. And it's amazing how the enemy can twist people's minds. And I think one of the big lessons is we must not accept this. Most of healing, of course, comes from God. We've got to have the relationship with God, pray into the Lord. He is, because the enemy isn't the creator. The enemy didn't create the earth, didn't create us. So God is the true healer. But we've got to get the enemy who's the spoiler, who's the one who will, you know, do anything he can to throw a monkey wrench into your healing and try to control you. And that's where people's minds go into genuine anguish, because the enemy's convinced them and lied to them, always in a very bad way, with a false identity, a false belief in who they truly are and what they can have, what they're worthy of, what they can expect. And we just got to kick this out. It's mandatory, because that's the block to the goodness and blessings of God, which is your birthright. So that's, I think, very crucial. When we do that, we got you. Then you're going to get everything you could ever want and ever need. But we must not let the enemy interfere, because it will always find some excuse to give you less than, or make an excuse for why life, you know, has interference and frustrations and, you know, whatever's going on that isn't right, or illness. So it's very important to do that. Again, I don't think we probably do it enough, as should be done, actually. But you need both. You need the truth and the blessings of God. You got to get that, weasel. He's a weasel. Got to get the weasel out of there. A little nasty weasel.
Right.
And you got to call rank of the enemy.
That's right.
Yeah, but I think, there's a lot where, the church, and they're not teaching in seminary that Christians can, have demons get into their body or into their mind and affect their health. So, what I'm finding out is a lot of health issues are demonic. I mean, obviously, go out and get a car crash, you can have trauma from that, but there again, some trauma
Still demons.
can also invite demonic into your body, because man is three. You have body, soul, and spirit. And our spirit gets born again when we become a Christian, but we still have a body and a soul that needs to be renewed, and that's where, through sin or trauma, something, or even generational things, you can have curses, witchcraft, and through witchcraft they can put a curse on people, and these demons get into the body, get into the mind, and affect your health, affect your mental state, and you've got to get it out.
And it loves to pass through the generations. That's why the generational curses are such a hassle, because because it can go at the level of your genetic material, where that vulnerability, that past experiencing just passes down, and also just on an experiential level, where this is what my family's lived with, this is what we're all about. There's one fellow I prayed into who had mental illness, and he was physically totally depleted, and he had a great healing. Even his career, he was having a lot of slowdown and lack, and God turned everything around with prayer. But he said, my whole family is this way. He said, everybody in my family is less than, and everybody accepts things. They accept that the things aren't going to be good. He said, and everybody's sick as a result. He said, everybody in my family is very physically sick. He said, I don't have a strong, vital family where everybody's an athlete or super strong and successful. And he said, my family, he said, we're just really limited. He said, this is typical of my family. He didn't want to be part of the pattern anymore. And for his own kids and their kids, but anyway.
Well, breaking the curse is vital. I mean,
crucial.
The Bible, Paul was right. He said, give no place to the devil. I mean, that's down. I mean, really. I mean, and we don't have to yield. And again, as believers, understanding the authority that we have in this earth realm.
We've got to do that.
So very important.
And never give up, even if it's moving slower than you want.
Mm-hmm.
And even if things seem to be piling up against you.
Right.
Just don't give into it. Just keep that faith and trust in God, all important. Tell the enemy to just go.
That's right.
Give the enemy off to the Lord. However you want to handle the enemy, just get the enemy out.
Right.
And get the enemy, disenfranchised from you, and in a way. And in the end, God will prevail. You've got to have patience, though. You've got to have, and then the joyfulness of the wonderful miracles that God produces. It just blesses you and blesses you and blesses you. In fact, let's pray into that now as we finish. Let's pray into, we can give a little bit of a crushing of the enemy, because who wants to? So Lord, let's all agree that we're just gonna, everybody, we can all pray together. Let's just, Lord, you are the Heavenly Father, and you're all powerful, and you're all good, and you're all full of love. You love each and every one of us. And I just want to pray against the enemy who comes to steal, kill, and destroy. We all know what the enemy doesn't come to uplift, love, and bless us. The enemy comes to kill, steal, and destroy.
Yes, Lord.
We don't want any trace of the enemy in any one of us.
Yes, Jesus.
We don't want it to manipulate our mind,
Thank
our
you, God.
body, our soul,
Yes.
anything. Lord, I just ask that you take the enemy away, and we want the enemy, however you're gonna do it, Lord, to just get crushed. We don't want an enemy, recycling and saying, gee, Susan or Jason or, Dan or anybody here looks, boy, does that look tempting. I think I wanna cycle on back to them. We don't want the enemy to even, we want such a divide
Yes, Lord.
between us and the enemy. They don't even know who we are.
Ah,
Throw them through the gates, get rid of them. And so, Lord, I just want to pray that this is an enemy-free place,
yes, Jesus.
that we're enemy-free people.
Oh, God.
Strong, healthy, blessed by God, and no sneaking in or trying to manipulate or trying to go into a vulnerable system,
Thank
like
you,
the
God.
limbic system in the brain. That's where
Yes,
the
Lord.
enemies sneak into. So we want to cleanse and purify every drop of us from the enemy,
Yes,
every
Lord.
cell, every neuron, every dermal and subdermal part of our body, internally, externally, Lord. We don't want a drop of this.
Yes.
And what we do want, Lord, is to be uplifted and blessed by you.
Yeah,
We want to
Lord.
focus on our Heavenly Father and all the love that you give us, and loving you, just experiencing you to the greatest, most possible extent that we could.
Thank you.
Because you are almighty, you are all precious and special to us. So I want to pray that everyone here be blessed
Oh, God.
in many ways. I
Yes,
want that you
Lord.
all
Yes,
be
Lord.
finished off in your physical healing.
Mhm.
Whatever parts of your body still need a little bit of work,
Ah, yeah.
let's just pray in the name of the Lord that it gets done all through God. Doesn't matter if it's, some like these cases I've shared, that everybody's got different issues.
Yes.
So, whatever it is that needs healing, I don't care if it's your muscles, your ligaments, your tendons, your nerves, your bones, your bursa, your synovium, your pancreas, your adrenals, your mood,
Yeah.
your mind, your immunity, things like Lyme disease, whatever it is, Lord, we want to bring it to you, bring it home, that you're home.
Yes,
for all
yes,
people.
yes,
And we want to
yes.
pray
Thank
out
you, Father.
all of the
Thank you, Lord.
that you gave every one of us
Yes,
as our birthright.
yes, Lord.
So I bless you all in the Lord. I thank you, God, for your love.
Thank you.
And I thank you for continued healing, continued blessing, continued strength of every single cell in your body,
Yes.
every single energy pathway in every one of your cells.
Yeah.
Be uplifted in the Lord, and so that we live free without symptoms because we're not sick.
Thank you, Lord.
What we want to end up is being people who don't know illness, people who don't know discomfort or strife or struggle or any lack. And Lord, that all comes from you. So I just bless every one of you here, and that I look forward next week to being with you again.
Yes.
And that I love all of you. It's just a beautiful time spent here. So thank you, Lord, for your creation of this. In Jesus' name, amen.
Amen.
Amen. With
Amen.
every one of you. Better, 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 better.
Amen. Wow. Wow, 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 wow.
Thank you, Lord.
Amen.